Hello, everyone. Our names are
Ernesto Alvarez.
and Shreya Palkurthi, and our project is GlaucDetect. Let's get started, but first, let's meet Dave.
Dave is a 50-year-old interim office manager for Corporation X. His job essentially consists of computer work, and more computer work, as he's looked to as the logistical backbone of the company. However, he's been suffering from an untreated glaucoma for the past 9 years and is currently in its advanced stages, making his job considerably more difficult over time. Dave has put this issue on the back burner of his mind because it's just part of growing old. Additionally, the new eye clinic is hours away from his rural company townhome and barely has enough funds to keep the lights on, much less to obtain standard equipment.
Our solution, GlaucDetect. GlaucDetect is a novel virtual reality-based device that intends to more cost-effectively and efficiently diagnose eye disorders as well as monitor their condition longitudinally because of its portability relative to more traditional devices.
Glaucomas are an immense issue both domestically and internationally. In 2021, the global glaucoma market was valued at $5.71 billion, and in this upcoming decade, it is projected to breach the $7 billion mark.
Our device possesses many features that distinguish it from its competitors. First, because of the typical older age range of patients who usually have glaucomas, we plan to opt for a more simple and analog appearance to aid ease of use and diminish costs. Too many digital features may not be the most accessible to the older generations, so we will try to minimize that as much as possible. Additionally, compared to traditional devices, which are much larger, we will use a compact, user-friendly headset. And to minimize difficulty related to sending user data to clinicians, it will be completed automatically after each eye exam in accordance with clinician specifications. Because of its compact nature, the device can even be taken home with the patient for either telehealth or longitudinal study or observation purposes. Finally, it'll be more affordable compared to our competitors due to diminished materials cost due to its smaller frame. High costs from VR headsets can be avoided by purchasing a more base-level chassis and simply adding appropriate modifications to the device.
GlaucDetect's revenue will be broken into three sections. First and foremost, we will directly sell the device to clinics, as do most businesses. However, we will also have programs to rent out our devices to clinics who may not be able to afford a long-term lease of the device, or simply just want to try it out. And finally, we'll offer smaller, adjustable, and customizable features. Think different material, different size headbands, and individualized components for specialized needs to make sure we offer something for everyone.
Currently, we have already done initial brainstorming and extensive patent searching, as well as competitive analysis for devices already in the market. On top of that, we have device schematics that we will implement soon in our initial prototyping. Finally, we are currently doing extensive cold calling to get more information regarding how to better refine GlaucDetect before we begin prototyping.
Coming this summer, we will plan to finish schematics for the prototypes while consulting our insight from our clinical explorations. Past that, we will purchase a base VR headset to begin reconstructing it based on our schematic.
Thank you so much for listening to our pitch. A little bit about ourselves before we close.
My name is Ernesto Alvarez, and I'm a second-year undergrad studying chemistry with a focus on the intersection of chemistry, biology, and biophysics.
My name is Shreya Palkurthi, and I'm a second-year undergrad studying biomedical engineering with a focus in genomics and immunoengineering.
We both share passion for innovation in the medical industry.
And we both have backgrounds in the design and engineering process through design team and robotics.
Help us revolutionize eye condition diagnosis and care for future generations.